What are joint injections for hip pain? What is meant by steroid injections and how can hip injections help me? If you are struggling with hip pain that just won't go away, it can be deeply frustrating. One option that people find reduce pain and inflammation in the hip is hydrocortisone hip injection, which is a targeted treatment that can make everyday movement easier. Hi, I'm Rakesh Kucheria, consultant orthopedic surgeon at Princess Margaret Hospital, part of Circle Health Group. In this video, we are going to talk about what hydrocortisone injections are, how they work, and why they might be recommended for your hip pain. If your hip discomfort is stopping you from enjoying life, understanding all your treatment options, including injections, is an important first step to getting better. So let's explore how these injections work and whether they might be right for you. Firstly, what is the most common cause of hip pain? Hip pain can come from a variety of causes. For many people, the source of long-lasting discomfort is inflammation in the joint caused by arthritis. There are two main types of arthritis: rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis and osteoarthritis both cause joint pain and stiffness, but they develop in very different ways. Osteoarthritis is a degenerative condition caused by gradual wear and tear of the joint over time, leading to cartilage breakdown and changes in the bone, and it typically worsens with activity and improves with rest. Rheumatoid arthritis, on the other hand, is an autoimmune condition in which the immune system mistakenly attacks the lining of the joints, causing inflammation, swelling, and pain that is often worse in the morning and can affect multiple joints symmetrically. While osteoarthritis tends to be related to age and mechanical stress, rheumatoid arthritis can develop at any age and often requires medical treatment to control inflammation and prevent joint damage. In other cases, pain may come from other nearby structures, but still feel like it's coming from your hip. Whatever the cause, the common problem behind the hip pain is inflammation and irritation that makes moving painful. What is a hip injection? A hydrocortisone injection, also known as steroid or cortisone injection, involves injecting a corticosteroid medication directly into the painful joint. This is called an intra-articular hip injection because the medicine is delivered inside the joint itself. Hydrocortisone belongs to a class of medicines called corticosteroids, which are powerful anti-inflammatory agents. When injected into a joint, they calm down the immune-mediated inflammatory response that is causing swelling, pain, stiffness in the hip. While these injections aren't a cure for the underlying condition, they can provide significant symptomatic relief and help you regain function. One of the most common reasons people are offered these injections is hip arthritis, particularly osteoarthritis, which occurs when the smooth cartilage inside the joint wears down over time. Arthritis can make the hip stiff, painful, and difficult to move. Steroid injections can help reduce the inflammation so you can walk, bend, or sleep more comfortably. Other causes that may benefit include inflammatory arthritis such as rheumatoid arthritis, bursitis, inflammation of the fluid-filled sacs that cushion the joint, and sometimes pain after injury if other conservative measures haven't helped. Hip injection is also a useful tool to differentiate where the pain is coming from. For example, it could be referred from your spine. How does a hip injection work? The procedure itself is usually straightforward. Before the injection, your consultant or specialist physiotherapist will assess your symptoms and examine your hip, and also may arrange imaging such as an X-ray to help understand what's causing your pain. This allows them to tailor the treatment plan to your individual situation and make sure an injection is appropriate. Hip injection can be done by a radiologist in an outpatient setting or in theatre under sedation by the surgeon. On the day of the injection, you will be positioned comfortably and the hip area will be cleaned and prepared. Often a local anesthetic is given first so you don't feel discomfort during this procedure. Then the hydrocortisone is injected directly into the joint. Many people describe the sensation as a short scratch or pressure rather than sharp pain. What can I expect after my joint injection for hip pain? One advantage of delivering the medicine directly into the joint is that the effect tends to be focused where it's needed most. The steroid works by calming the inflammation over the next few days. It's important to know that relief is not always immediate in many cases. It begins a couple of days after the injection and can improve over the following week. Most patients find the relief lasts several weeks to a few months. In some cases, it can even last longer. Exactly how long varies from person to person. You may find that one injection gives enough relief to help you progress with physiotherapy, daily activity, or return to sport. In other situations, repeat injections may be discussed. It is worth noting that while these injections are generally safe and well tolerated, there are risks and considerations. The most common reactions include temporary pain, swelling, bruising at the injection site, or short-term increase in discomfort in the days after treatment. These typically settle down. Rarely, more significant complications can occur, such as infection inside the joint, allergic reactions, or changes in the tissues around the injection. That's why the procedure should always be performed by a trained professional in a clean, clinical environment. Guidelines often recommend limiting the frequency of steroid injections into a joint to avoid potential tissue weakening or cartilage damage if used excessively. Your consultant will discuss this with you and plan an appropriate schedule based on your individual situation. What is the recovery period like for steroid hip injections? After the injection, your clinician will usually advise you to rest the hip for 24 to 48 hours. Avoid strenuous activity or high impact exercise during this time, even if you start to feel some relief early on. Gentle walking and normal daily movements are fine as long as they are not painful. It's also a good opportunity to integrate physiotherapy or progressive strengthening once the initial rest period is over. Most patients find that having an injection opens up a window where they can engage more effectively with rehabilitation activities, strengthening the muscles around the hip, and improving long-term outcomes. Consider this part of a broader treatment plan rather than a standalone fix. Deciding whether hydrocortisone injections are right for you depends on a range of factors: the cause and severity of your hip pain, your lifestyle and activity goals, other treatments you've tried, and overall health. Together with your consultant, you can weigh the potential benefits against the risks and other options such as physiotherapy and in some cases surgical treatments. If your hip pain is limiting your life and everyday movement, hydrocortisone injections may offer meaningful relief by reducing inflammation and helping you move more comfortably. They are widely used, safe option when performed by experienced specialists, and they can be especially helpful when combined with a broader plan of physical therapy and lifestyle adjustments. To find out more or discuss whether hip injections could be suitable for you, visit the Circle Health Group website or book a consultation using the link in the description below. And finally, if you found this video helpful, leave a comment with your questions or topics you would like covered next. And don't forget to browse our channel for other expert insights on joint pain and orthopedic treatments. Thanks for watching.